I usually tell people that the patients that come to the ICU, they're the worst COVID.
As a nurse in the intensive care unit, Kyle Gordon Bidwell's job is a balance of delivering care and dealing with the realities of those who need it.
Unfortunately, most of our patients pass away. They don't make it out.
As contentious a topic as COVID has become, when someone enters the ICU, the truth is direct.
We'll do everything we can to save you, because it is what it is, right? You have COVID, and we'll do our best to save you.
Like many ICUs nationwide, the majority of COVID patients who enter Michelle Hurd's Central Michigan unit are unvaccinated. Here, the hospital says it's 9 out of 10.
It's hard to understand why some are not vaccinated. And so when I'm with my nurses, it's non-judgmental. The person is here for our care.
This is actually the worst part, when you see somebody who is 40 years old or 50 years old, and he just did not believe in the vaccine. And all of a sudden gets that sick in the ICU, and he said, the minute I leave the ICU, I will get vaccinated. And that's very sad, because sometimes they don't.
Dr. John Blamone says at Mid-Michigan Medical Center, the number of patients isn't as much a problem as the impact this pandemic has had on those who care for them. Like many hospitals, workers have left.
When I go home at night, I'm exhausted. Sometimes it takes a couple days to get recovered from my shift.
Largely, it's just powering through, being there for our patients, being there for my coworkers, and just trying to continue to do my best with that. I will say I don't know that I'm for sure through it.
The Delta variant has brought a strain on emotions and resources that many here thought would be over by now.
When we saw how effective vaccination was and things started to open back up, I was really taken aback that we have a significant minority of the population that just won't get vaccinated, and it's putting us all at risk.
But as patients continue to pack ERs and ICUs, many hospital systems, including this one, face an internal struggle. Around 37% of employees with Mid-Michigan Health, which runs multiple hospitals in central and northern Michigan, are not fully vaccinated. While Dr. Blamone regularly sees what this virus does to those who haven't received the vaccine, he says mandates aren't the answer.
I believe that people should not be forced to get vaccinated, should not make people's life difficult to get vaccinated.
Instead, he hopes the liberty to choose empowers personal responsibility.
We should be united in one message, which is we are all in this together, and we should be vaccinated for the good of everyone.
Decisions, he says, will save lives and bring relief to those still fighting on the front lines.